Hi, my name is Tracey Butler and I'm the Director of Links to Learning. Firstly, I'd like to congratulate you on your decision to complete the Level 1 certification course to become a provider of the listening program. I can assure you it will be a rewarding journey and enable you to achieve even better results with those you're working with today. So I hope you enjoy this day 1 of training, and I look forward to you joining me for day 2, which will give you the opportunity to be with me live and ask questions that may come up or cover any questions that may arise from what you're viewing today. So we'll begin with the listening program overview. The Listening Program Provider Certification course will help you discover the scientific evidence behind the listening program and learn hands-on practical application for addressing essential brain performance areas to improve outcomes in executive function, auditory processing, communication, social and emotional, motor coordination, stress response, and creative expression for children and adults with a range of needs. The listening program is an evidence-based neurotechnology that improves multiple functions in the brain. We have structured protocols, yet flexible to meet individual needs. It's portable between school, work, and home, and you can train in as little as 15 minutes. It's a highly enjoyable experience, which is what I think attributes to the high successful rate of outcomes. We're not asking these children to do something they find difficult. When we consider who benefits from the listening program, those with learning difficulties, those on the spectrum, those with sensory processing issues, developmental delays, dyslexia, reading problems, brain injuries, stroke, cerebral palsy, Down syndrome, post-traumatic stress disorder, those with sleep challenges, as well as stress and anxiety and overall brain health. Alex Doman founded Advanced Brain Technologies in 1998 to focus on the ongoing development of the listening program and other neurotechnologies for advancing people's brains. The company is based in Ogden, near Salt Lake City. The listening program was first offered in late 1999, following many years of research and development. The method was initially developed by a multidisciplinary team of professionals organised by Alex Doman and his father, Robert Doman, at the National Association for Child Development to meet the need for evidence-based, safe, effective, accessible and affordable music listening therapy that was easy to use and could be done anywhere. If we explore some of the most important milestones in the listening program, we can see that it was originally offered in a CD series called the Listening Program CD Delivery. And then in 2000, we had our supplemental specialised sensory integration and speech and language albums. In 2003, the classic program became available. And then in Level 1, 2004, which introduced spatial surround technology, high definition recordings, and Dolby headphone technology, which we'll discuss later on. In 2005, we had the introduction of facility-based bone conduction, and then in 2006, Level 1 was released with nature sounds. In 2007 was a real game changer. We were given access to a home-based bone conduction unit via an iPod delivery, which meant that our families now had access to portable bone conduction in their own home every single day of their therapy. In 2012, Spectrum, Achieve, and were released, and you'll learn about those when we go through program options, along with TLP online beta testing and the Waves multisensory bone conduction system. In 2013, TLP Online was initially launched along with the Sleep Genius program. In 2014, the percussive rhythm world music program called In Time was released, and the TABS, which is the test of auditory and visual skills, an assessment tool that as a TLP provider you can train to be able to use. Sleep Genius on mobile apps was also released in 2014. And then in 2015 we had the release of Spectrum Plus, Achieve Plus, Level 2 and Shift 60, which you'll learn more and more about. So, a practice of listening to acoustically modified music that supports improved brain function. The listening program provides progressive training across 4 sound frequency zones, using acoustically modified music listened to through headphones. It's practiced on a regular basis 5 days a week. The duration of daily practice and the overall program depends upon the needs and goals of the listener. The daily practice involves personalised listening training with headphones to 1 or 2 15 to 30-minute sessions. A typical program will be 40 weeks or more and can be continued for further benefit. During the listening, listeners do what they like, including simply relaxing, doing artwork, or engaging in quiet activities. For our more active mobile listeners, we have tune belts and we strap the equipment on them so they can go outside and play on swings, jump on trampolines, and encourage that movement for them. Listening protocols are provided on an iPod and overseen by a trained and certified provider of the method. We use the program for ages 2 through to adults. When we look at brain focus areas, the applications of the listening program are very diverse, ranging from a rehabilitative tool to intervention to a means to stimulate peak mental and physical performance. The minimum age requirement is 2 years, and we work right through to adults. The listening program was created to support improvement in executive function, auditory processing, communication, social and emotional function, sensory motor, stress resilience, and creative ability. It's a fusion of art and science. The music in the listening program and all of our products is our own. It's not licensed, but recorded and produced by us to the highest audio recording standards using advanced neuroacoustic production processes. We believe in maintaining the beauty of the art while giving it a specific use to improve your health and mental performance. Our creative and scientific teams strike the balance of high art complemented by sound science. While firmly rooted in science, the listening program is also art. The brain responds best to enjoyable experiences. What's more pleasing and engaging than beautiful music? We place a high value on the content and quality of the music used for the listening program. Because of this, every note you hear in the listening program has been performed by our own world-class musicians, each carefully selected for our recordings. TLP provides a clear structure from which the provider can develop fully personalised, adaptive programs to meet each person's individual goals. It fits daily into a routine and becomes a healthy habit, something you can do effortlessly, but with life-changing benefits. There is no learning curve, no task demand. Just enjoy your listening for 15 to 30 minutes a day. The zone training chart represents what we call the frequency zones and is adapted from the clinical research of the late French physician Dr. Alfred Tomatis. Each zone corresponds to a range of sound frequencies that related to different areas of human function and performance. The frequency zones were initially established based on Dr. Tomatis' clinical observations and audiometric testing that suggested a relationship between deficits in auditory perception and brain function. For example, if there were deficits in perception of frequencies in the speech range of sound, the orange zone, deficits in speech could often be observed. Dr. Tomatis found through training those frequencies with acoustically modified music, the deficits could be restored, and when this happened, the speech function also improved. These zones serve as a reference to provide the provider, when developing a listening program, an understanding. This will be expanded on through the course. What is most important to know at this point is that there are zones, and each related to a band of sound frequencies. As you work with each listener and the areas in their life you're working to help them improve, you will do so with the understanding that these can be influenced through the music frequency of each zone in the listening program. The listening program is largely built around this zone structure. We all know that the brain is highly complex and the zone chart is rather simplistic. but it serves as a useful framework to build on for the listening program. The ABC modular design is one key to the success of the listening program and is one of its exclusive components. Each listening experience is framed within what we call a module. The foundation of each module begins with our high-quality recording of acoustically modified music. The music has a frequency focus matched to the specific zone, either blue, green, orange, or red. Each model is multi-dimensional in terms of the type and intensity of listening training being presented. There are continuous changes happening seamlessly in music composition, tempo, frequency, volume, and spatial features. Modules are designed to present the ideal training balance, which is to continually challenge your brain, advance your listening skills, while also regulating attention and arousal to prevent overload by keeping you calm and relaxed. Modules are an average length of 15 minutes, each segmented into 3 5-minute training phases. They progress from A to B to C. The A phase is the warm-up, which transitions from low to moderate intensity training, then shifts to the B phase. The B phase presents and sustains maximum intensity training and then shifts to the C phase, which transitions from moderate to low intensity, which is the cool down. So the ABC modular design is similar to an aerobic workout with a warm-up, a workout, and then a cool down phase. The listening program is an easy, pleasurable, and effective method to improve your brain health and performance. Based on sound science, our evidence-based music trains the brain to improve how you perceive, process, and respond to the flood of sensory information in our environment today. This leads to personal growth, helping you live a happier, productive, and more fulfilling life. Sound brain fitness is like physical exercise, and everyone can benefit from the listening program. Whether an athlete training for a triathlon, a child learning to read, or someone going through rehabilitation to recover from a brain injury. Men, women, and children of all ages and walks of life and corners of the world have been helped by the listening program to perform better in school, work, home, and all areas of their lives. We're going to discuss research and reference slide content. All studies are available at advancedbrain.com/science. This is a quantitative summary of some of the existing research examining the effects of the listening program on various functions in children presented. 9 studies were used looking at the TLP intervention effect across studies within each study and for various outcome measures. The studies looked at TLP intervention on children with autism, Down syndrome, learning disabilities, auditory processing disorders, attention deficit, Rett syndrome, dyspraxia, cerebral palsy, fibromyalgia, arthritis, and stroke. The effect size of various outcome measures is discussed in order to identify variables that might affect the outcome, as well as what these results mean to occupational therapists and other professionals. We will review several research studies investigating the benefits of the listening program, starting with this one published in the International Journal of Therapy and Rehabilitation. The author investigated changes in mood, so calm versus anxious, attention to task and person engagement in young people with profound and multiple learning difficulties, including auditory processing deficits, who participated in the listening program. Those behaviours were also examined following exposure to regular music. The method: in a multiple single case study, 12 participants aged 9 to 19 completed TLP plus a shorter placebo regular classical music cycle. Assessment procedure included video recording, observational checklists, the school's profound education curriculum, and a post-study questionnaire for carers. The results: greater indications of positive change were seen in attention to task and person engagement after the listening program than with regular music. These positive changes were more apparent in participants with sensory processing difficulties, particularly those with Rett syndrome. Improvements in mood were observed following both regular classical music and TLP for those with sensory processing difficulty, which would be expected. This 28-week study of 3 children with ASD following an AB multiple events case-controlled design supports prior results demonstrating that the listening program is a beneficial therapy for sensory issues related to autism spectrum disorder, specifically auditory sensory overresponsivity. The purpose of this single subject case design was to explore the efficacy of using the listening program method to improve overall sensory processing and receptive expressive language skills in a child diagnosed with pervasive development disorder not otherwise specific. The child increased eye contact with his teacher, caregivers, was smiling, waving, and improved interaction with his peers. On the post-intervention listening checklist, he showed improvements in every receptive area that had previously had a deficit. This is a peer-reviewed article on the effectiveness of the listening program, published in 2009. Author Amy Nawara worked in the OT department in Buffalo, and Brian McGee worked in the Department of OT at Idaho State University in Idaho. The study also revealed that the Dunn sensory profile scores indicated marked improvements in function from pre to post intervention. The purpose of this ABA single subject case control design was to explore the efficacy of using the listening program with a 7-year-old child diagnosed with autism who also demonstrated auditory overresponsivity. The intervention was 30 minutes a day, 5 days a week for 10 weeks using specialised air and bone conduction headphones. This is only half of the minimum recommended 20-week protocol. Repeated measures were conducted using the sensory processing measure and the sensory overresponsivity scales. The results indicated that the participant exhibited a decrease in the number of negative, avoidant, verbal and physical negative and self-stimulatory behaviours. The authors recommend implementing the listening program across 20 continuous weeks as recommended. It is the author's opinion that sensory-based interventions, which TLP may be classified as, should be used as part of a comprehensive occupational therapy using a sensory integrative approach, as opposed to a standalone intervention outside of OTSI. The Paediatric Continence Promotion Service in Liverpool accepts referrals for children with a wide range of bladder and bowel problems, including delayed toilet training. Although it was very successful in the main in enabling children to become toilet trained, there were a group of children, despite everyone's best efforts, who continued to be resistant of sitting on the toilet. Becoming toilet trained is a milestone all parents strive for, yet many children with special needs are overwhelmed at the prospect. Clinical experience has shown that many of the children initially referred to the continence service were non-response to toilet training were able to make progress. The results from the pilot project exceeded all expectations. The hope was at the end of the study that these children would at the very least be relaxed enough to sit on the toilet and cooperate with the toilet training program. The fact that 7 of the 11 children who completed the listening program became toilet trained is very encouraging and suggests that perhaps TLP may just be the key to unlock their potential. The remaining 4 made progress and eventually toilet trained as well. A UK pilot study evaluated the suitability of testing for auditory processing and speech skills for children with Down syndrome. 9 children aged 5 to 12 took part and acted as their own controls. Each used the listening program through headphones over 10 weeks for 2 15-minute sessions 5 days a week. The children in the study showed improvement from the use of the listening program with clearer speech, more extensive vocabulary, improved auditory discrimination, and greater attention. These results mirror outcomes from other studies of the listening program. We've reviewed just a few of the scientific investigations into the listening program to provide some insight into the efficacy of this form of intervention for a broad group of individuals. This study here looks specifically at how the listening program combined with air and bone conduction could help adults suffering from burnout and stress compared to the standard course of care provided in the Swedish primary healthcare system, which is psychotherapy. 2 randomised groups were treated for 20 weeks, 16 subjects, 8 per group. Adults who worked in childcare who had stress-related symptoms, burnout. So one group was seen by a psychologist and one group the listening program using an air and bone conducted delivery. 2 standardized questionnaires which are used for stress and burnout were used. Stress and crisis inventory results are seen on the left and Sharon Melamed burnout questionnaire on the right. The listening group shows statistically significant improvement compared to baseline at 10 weeks, 20 weeks and 8 months, with no meaningful improvement in the psychologist group. Not only did these listening patients improve, they maintained their improvements well after listening stopped, demonstrating the staying power of the changes. The study was replicated with the same group size with almost identical outcomes. This article describes the application of the in-time neuroacoustic training by Advanced Brain Technologies when they were organising assistance to children who had learning disabilities. This training optimises the functional state of the brain by using sounds of various frequency and rhythm. The effectiveness of the in-time technique was monitored by the complex auditory subcortical evoked responses, functional diagnostic test developed by the specialists of the Prognoz Children's Neurological Center in St. Petersburg, Russia. The article shows that the in-time program improves the effectiveness of intervention to overcome learning disabilities. This method is suggested to be used in schools in order to help support learning processes of children with learning disabilities, as well as to help children of the at-risk group. It was completed by Doctors Victoria and Oleg Efimov, with 36 children with developmental disorders. I'd like to share an inspiring case study of an 8-year-old Italian boy named Niccolo. His mother was kind enough to put together information to present his progress with the listening program today. Niccolo followed TLP spectrum protocol using the Waves multisensory audio system bone conduction delivery. Niccolo had been doing other therapies like hyperbaric oxygen, hippotherapy and bioenergy work, which in the last 4 years had brought tremendous results. What I'm sharing with you today are the changes that started taking place after the listening program was added to his therapy regime. Within the first 4 weeks, he suddenly seemed more aware of his environment, inquisitive and observing things, asking a lot of whys. She felt somehow that the listening program had triggered something in his brain. After 2 months of using the listening program, we had our yearly speech cognitive and motorial evaluation, which emphasised progress in the following areas: improvements of attention with longer periods of attention, much less distractible, improvements of communication initiative, general improvement of global movement, improvement of postural control for longer periods, improvements of walking and running with 2 feet, jumping possible now for longer periods. At this point, Niccolo had completed only half of the initial recommended protocol, and the expectation would be that his improvement would continue. Today, Niccolo has moved forward with the in-time program and is progressing very well with the addition to his protocol. In summary, systematic training through non-invasive means using acoustically modified music stimulation often gives very significant results in the improvement of sensory processing, achievement of developmental milestones, lower stress levels, and improve brain performance as part of a holistic approach. The evidence base for our auditory stimulation therapies is growing, and the clinical findings are encouraging. The better we process sensory information, the better we can understand and engage with our environment. And now I'm going to give you the opportunity to experience the listening program. So if you plug your headphones into your computer, sit back and relax. You're listening to a blue album, which we refer to as full spectrum. So it has the full spectrum of sound frequencies. And this is album 1 from the Level 1 listening program.
This module is now complete.
So hopefully you enjoyed your first listening experience. I want you to just take a moment to focus on how you feel in your body, in your mind, whether or not you can observe a noticeable state of feeling more relaxed, potentially. So we're going to move on to sound and function. And in this session, we'll provide an overview of the elements of sound, the basic physiology of the ear, the conduction of sound from the ear to the brain, and most importantly, sound's influence on the human nervous system. So sounds are created when objects vibrate. Sound waves that we hear are fluctuations in air pressure across time. Sound is a travelling wave, which is an oscillation of pressure transmitted through a solid, liquid or gas, composed of frequencies within the range of hearing and of a level sufficiently strong to be heard, or the sensation stimulated in organs of hearing by such vibration. In physics, resonance is the tendency of a system to oscillate at larger amplitude at some frequencies than at others. These are known as resonant frequencies. Some examples of resonance are tides, the time-keeping mechanisms in clocks and watches, tune circuits on radios and TVs, and orbital resonance. The most important example for our purpose are the acoustic resonance of musical instruments, human vocal cords, and the resonance of the basilar membrane in the cochlea. This enables people to distinguish differences in frequencies that they hear. When certain sound frequencies of sufficient volume intensity reach the hair cells of the cochlea that match their resonant frequencies, those hair cells are triggered to send those frequencies to the brain so that they can be heard. It is possible to train the brain to better discriminate frequencies by matching the frequencies that we hear, by playing them on musical instruments and enhancing the frequencies with psychoacoustic methods. Psychoacoustics is the psychological study of the human perception of sound. I will touch on 4 elements of sound that form a foundation for our auditory perception. They are frequency, amplitude, time, and space. The listening program is designed to train the brain's ability to perceive and process these foundations of auditory perception. A sound is determined by the frequency of a vibration, or how often the vibration repeats itself in a unit of time. In acoustics, frequency is measured in hertz. 1 hertz means that the vibration repeated itself once per second. 2 hertz is twice per second, and so on. Sound vibrations are composed of frequencies capable of being detected by the auditory system. For humans, the range of hearing is 20 to 20,000 hertz. Our upper limit generally decreases with age. Our perception of the frequency of sound is called pitch. Low frequency sounds correspond to low pitch, like the low notes on a cello, and high frequency sounds correspond to high pitches, like the high notes on a piccolo. The brain processes the sounds of music and language in a similar manner. Amplitude is the magnitude of displacement, the increase or decrease of a sound pressure wave. Amplitude is associated with the perceptual quality of loudness. The more intense a sound wave, the louder it will sound. The greater the intensity of a sound wave, the greater the air pressure variations will be on the eardrum. We normally refer to volume to describe loudness. The higher the volume, the louder the sound. The lower the volume, the softer the sound. The unit of measure for the intensity of sound is decibel. Decibel defines the differences in the sound pressure between 2 sounds. There are safe loudness levels and levels that are harmful. Recommendations on safe exposure levels vary, and there is a broad range of individual differences among people in the amount of hearing loss each may suffer as a result of identical sound exposure. Current scientific knowledge is inadequate to predict that any particular individual will be safe when exposed to hazardous noise. We recommend that listening with headphones always be done at comfortable levels, and that when listeners are in noisy environments such as movie theatres, they consider wearing foam or wax earplugs for hearing protection. When inserted properly, they can lower loudness perception by up to 29 decibels. Sound and neural impulses originating in the cochlea are events in time. Our ability to hear, speak, and understand language and appreciate music are all time dependent. Sound information is carried in a time sequence with nerve fibers in the cochlea firing in phases referred to as time code. Life itself is all about timing, as studied in the field of chronobiology, the scientific field examining biological rhythms. The importance of time perception in the auditory system is demonstrated in prosody, which reflects various features of the speaker or utterance, the emotional state of a speaker, whether the utterance is a statement, a question, or a command, or whether the speaker is being ironic or sarcastic. For example, if your child were to say, "I want another mother," versus "I want another mother," the timing completely changes the meaning. Suppose you're a parent and you walk in the front door after work and announce that you're home, and your oldest child yells out, "Welcome home." You would instantly know where she was in the house based on your examples of sound localization. You would be able to find your child in part because of the interaural time difference, which is the difference in the time between a sound arriving at one ear versus the other. This detection happens in the medial superior olive, a relay station in the brainstem where inputs from both ears contribute to the detection of interaural time difference. The second cue to sound localization is called interaural level difference. This is the difference in level of intensity between a sound arriving in one ear versus the other. The neurons, which are sensitive to intensity differences between the two ears, are in the lateral superior olive, which is also in the brain stem. Our ears inform our brain about where our body is in space and can tell us where we are in the world, even without visual input. Knowing where sound occurs gives us critical information to understand whether or not we are safe in our environment, thus playing a key role in our survival. Even the pinna, the visible portion of the outer ear, plays a role in sound localization, as the shape of the pinna affects how we hear sound from different places in our environment. We have three divisions of the ear. It's a very complex organ that is usually regarded as part of the auditory system. However, more accurately, it basically functions as a motion detector, receiving vibration for hearing and position and movement through its auditory and vestibular receptors. From our simplified perspective today, we focus primarily on the auditory aspects of the ear, or the parts of the ear that tune into vibrations, which will ultimately be processed as sound. Self-regulation, balance, touch, visual integration, activities of the mouth, gut function, emotion, social engagement, and language are all connected either directly or indirectly through the ear and the nervous system. We'll briefly review the ear and then look at two ways in which it receives sound as vibrational energy, air conduction, and bone conduction. As mentioned, the ear is made up of three divisions: the outer ear, the middle ear, and the inner ear. We'll explain the divisions and their functions to help provide a full understanding of the auditory system. This video depicts what happens when sound enters the ear.
The sense of hearing is accomplished by a process known as auditory transduction. The ear converts sound waves in the air into electrical impulses, which can be interpreted by the brain. As sound enters the ear, it passes through the external auditory canal, where it meets the tympanic membrane. The tympanic membrane then vibrates in response to the sound. Sounds of a lower pitch, or frequency, produce a slower rate of vibration, and sounds of lower volume, or amplitude, produce a less dramatic vibration. Higher frequency sounds produce faster vibrations. The tympanic membrane is cone-shaped and articulates with a chain of 3 bones called the auditory ossicles. They consist of the malleus, the incus, and the stapes. The movements of the tympanic membrane vibrate the ossicles, passing on the information of frequency and amplitude. The 3 bones pivot together on an axis shown here in red. The pivotal axis is due to a series of ligaments which hold the bones in place within the middle ear cavity. The anterior malleal ligament and the posterior incutal ligament are of particular importance for the pivotal axis. 2 structures which normally obscure this view of the middle ear have been removed. They are the chordae tympani nerve and the tendon of the tensor tympani muscle. Through the ossicles, the vibrations of the tympanic membrane are transferred to the footplate of the stapes. The stapes moves with a piston-like action, which sends vibrations into a structure called the bony labyrinth. The labyrinth is filled with a fluid called perilymph. If it were a completely closed and inflexible system, the movement of the stapes would be unable to displace the perilymph, and therefore unable to send vibrations into the bony structure. Due to the flexibility of a membrane called the round window, the stapes movement can displace the perilymph, allowing vibrations to enter the labyrinth. The corridor leading to the round window is found within the spiral portion of the bony labyrinth, known as the cochlea. Vibrations produced by the stapes are drawn into the spiral system and return to meet the round window. The portion of the spiral passage in which vibrations ascend to the apex of the cochlea is called the scala vestibuli. The descending portion of the passage is called the scala tympani. A third structure, called the cochlear duct, is situated between the scala vestibuli and the scala tympani. The cochlear duct is filled with a fluid called endolymph, and when viewed in cross-section, the membranes separating the 2 fluid-filled systems are visible. They are Reissner's membrane and the basilar membrane. The membranes are flexible and move in response to the vibrations traveling up the scala vestibuli. The movements of the membranes then send vibrations back down to the scala tympani. A specialized structure called the organ of Corti is situated on the basilar membrane. As the basilar membrane vibrates, the organ of Corti is stimulated, which sends nerve impulses to the brain via the cochlear nerve. The actual nerve impulses are generated by specialized cells within the organ of Corti called hair cells. The hair cells are closely covered by a structure called the tectorial membrane. As the basilar membrane vibrates, the tiny clusters of hairs are bent against the tectorial membrane, triggering the hair cells to fire. The entire basilar membrane does not vibrate simultaneously. Instead, specific areas along the basilar membrane move variably in response to different frequencies of sound. Lower frequencies vibrate the basilar membrane closer to the apex of the cochlea, whereas higher frequencies produce vibrations closer to the base. This arrangement is known as tonotopic organization. Together, this sequence of events is responsible for our acoustic perception of the world around us.
In addition to the ossicles, the middle ear also has two muscles, the tensor tympani, which is attached to the malleus, and the stapedius, which is attached to the stapes. As you might expect, these are the smallest muscles in the human body. Their main purpose is to tense when sounds are very loud, to restrict the movement of the ossicles. This dampens the intensity of the pressure changes which can damage the delicate structures of the inner ear. Unfortunately, the acoustic reflex, which protects us from intense sounds by contracting the middle ear muscles, follows the onset of loud sounds by about 1/5 of a second. So while it helps us in environments that are loud for a sustained period, the reflex cannot protect us against sudden, loud sounds above 110 decibels, a gunshot, for example. However, even continued exposure to a sound at lower levels, such as a crowded restaurant, can fatigue the muscles and reduce their protective function. The muscles of the middle ear can be tensed during swallowing, talking, and body movement. This helps to keep the auditory system from being overwhelmed by the sounds generated by our own bodies. Normally, the middle ear chamber is filled with air to allow the transmission of sound. The eustachian tube links the pharynx to the middle ear and equalizes pressure between the middle ear and the atmosphere. It also drains mucus from the middle ear, but with upper airway infections or allergies, the tube can become swollen, trapping bacteria and causing ear infections or fluid. This is the leading cause of permanent hearing loss in children and can cause speech delays. When the fluid is present, it causes a temporary 20 to 40 decibel hearing loss, which distorts the sounds of speech. It's like hearing underwater when swimming and can be very painful. The inner ear carries a bony labyrinth called the vestibular system. The vestibular system has a primary influence on our balance. It gives us an understanding of our relationship with our three-dimensional world and our ability to sense our position and movement in space. Sharing the inner ear with the cochlea, the vestibular apparatus is comprised of 3 semicircular canals and the vestibule. The vestibule connects with the cochlea. Hair cells similar to those in the cochlea are found within the vestibular apparatus, embedded in a gelatinous membrane. These hair cells, like those of the cochlea, respond to mechanical events that serve to bend or deflect hair cells. Electrical impulses resulting from the bending of the hair cells are also carried by the 8th cranial nerve to stimulate the central nervous system. The semicircular canals situated in diagonal vertical planes that intersect at nearly right angles are named according to their positions: superior, horizontal, and posterior. They are stimulated by rotational and angular movement in all directions. Semicircular canals have not been found to be responsive to sound in typical humans. The vestibule contains 2 otoliths, which refer to as gravitational receptors, the utricle and the saccule. Each contains a macular housing, a cluster of hair cells. Otoliths are stimulated by linear movements. accelerations, gravity, and vibration. The utricle is orientated horizontally in the vestibule and senses motion primarily on the horizontal plane. The saccule is oriented vertically in the vestibule and senses motion on a vertical plane. Both the utricle and saccule sense vibration. Both the utricle and saccule respond to audible sound. Yet it should be noted that only through bone conduction of sound are the otoliths known to be able to receive sound within safe listening levels. The vestibular system integrates with the visual system, allowing us to maintain a steady gaze despite movement of our head. It also integrates with the proprioceptive system, the sensory system which provides us with information about the position and movement of our body parts through input it gets primarily from muscles. This is the system which gives us our sense of where we are positioned in the world and gives us information about how to move within our environment. Dr. Alfred Tomatis referred to the vestibular system as the ear of the body. Having reviewed the basic anatomy and physiology of the ear, let's move on to discuss the two ways in which the ear receives vibrational or sound input: air conduction and bone conduction. Have you ever listened to a recording of your own voice? If so, you are likely to recall that it did not sound like you. In fact, you probably didn't like the way it sounded. As I speak to you now, you are hearing my voice being carried to your ears through air. That is through air conduction. That's also picked up when we do a recording. However, when I speak, my voice resonates within my body, particularly through the bones of my skull and spine, especially the cervical spine of the neck behind the larynx or voice box. When I listen to my own voice as I speak, I pick up on those vibrations conducted through the physical matter of my body by way of a mechanism referred to as bone conduction. Neither you nor the recording picks up on these vibrations. You hear me through air conduction, but I hear myself primarily through bone conduction. Our own voices are said to be part of our primary source of bone-conducted sound. Let's do a quick exercise. I want you to hum for 15 seconds, and then I want you to cover your ears to occlude outside sound and continue humming for another 15 seconds. Did you notice the difference? This experience comes as a surprise to most people. So sound travels faster through living physical matter of our bodies, especially bone, than through air. In addition to our voices, the internal sounds of our bodies, the sounds of our movement, especially those of the mouth, and sound from the external environment can be perceived through bone conduction. It is possible to hear through bone conduction alone, but typically the ear is receiving sound in both ways, air conduction and bone conduction. For example, when you listen to music optimally, you are listening through naturally occurring relationship between air and bone conduction. As we've already discussed, receiving sound vibrations through bone conduction actually involves more than bone. Tissue such as soft tissue and skin and fluid within our bodies are also involved. Bone conduction is a naturally occurring phenomenon. When you listen to the listening program through the Waves multisensory audio system, a transducer or vibrator on the headpiece provides enhanced bone-conducted sound stimulation, while the earpiece of the headphone enhances air-conducted sound. The net effect is an optimally balanced listening experience. Both the cochlea and the vestibular apparatus respond to bone-conducted sound. The vestibule, as we discussed, is most sensitive, especially to lower frequency sound, in the green zone. For our purpose and in order to understand what we're doing with the wave system, let's review the 6 ways in which vibration of the head has been found to be conducted to the inner ear. Compressional bone conduction, which is skull vibration compresses and expands the cochlea, which leads to a basilar membrane vibration. Inertial bone conduction. Skull vibration creates inertia of the ossicular chain, which goes on to affect the inner ear. Osteotympanic bone conduction. Skull vibration is transmitted to the external auditory canal, surrounding soft tissue and other structures to elicit tympanic membrane vibration. Skull vibration penetrates the skull and establishes audio frequency pressures in cerebral spinal fluid, which create changes to the inner ear fluid. And finally, vibration of skull tissue is also affected, and stimulation of the skin or vibrotactile input transmits sound to the inner ear. It is important to highlight some of the unique attributes of bone conduction. 1, it is by means that developing fetus hears in utero. By 16 to 20 weeks gestation, the fetus is listening and responding to the mother's body rhythms and voice and sounds outside of the womb. Bone conduction sound provides our first experience with the outer world. As the fetal nervous system grows, it is doing so with the influence of bone-conducted sound stimulation. Bone-conducted sound comes from both external and internal stimuli. As we've said, bone conduction is a means of stimulating the inner ear without having to involve the middle ear. Therefore, it could be very helpful to use wave system with listeners who have a history of or currently have middle ear fluid or infections. Bone conduction provides stimulation to both the auditory and vestibular apparatus with safe sound listening levels. Air conduction does not. In order to stimulate the vestibule with air-conducted sound, the stimulus must be at a very loud level, which could be damaging to hair cells if sustained. So bone conduction is more safe and effective than air conduction as a means of stimulating the vestibular system. A few more aspects of bone conduction for you before we move on. Bone conduction vibration provided at a single location can stimulate the inner ears bilaterally. When using the Waves audio system, the vibrator is placed in the middle of the top of the head and can be heard in both ears. We've mentioned that sound travels faster through bone than air. Bone-conducted sound can help us prepare for what is delivered via air conduction. This is the reason why we can make corrections to our speech mid-utterance, because we hear our own voice through bone-conducted sound sooner than we hear it through the air. We shared earlier in the session that the body can sense vibrations from 10 to 100,000 hertz. These vibrations move through the physical body. If they are of sufficient strength to make their way to the inner ear, those bone-conducted vibrations within the 20 to 20,000 hertz range are picked up as audible sound. Below or above this range, the vibration is likely to affect us, but we do not perceive it as sound per se. Sounds within a lower frequency range stimulate the receptors in the vestibular apparatus best. So the low frequency stimulation provided in the listening program, especially the music in the green zone, is optimized when listening through waves. While the classical auditory pathway from the ear to the auditory cortex is most familiar, sound can take several direct and indirect ascending pathways within the central and peripheral nervous system. Mechanisms, connections, and interrelatedness of these pathways are receiving increasing attention and study. Let's begin this overview with the classical auditory pathway. Air-conducted sound travels through the air-filled outer and middle ears to reach the inner ear. Bone-conducted sound travels via physical matter to reach the inner ear and is then carried by the 8th cranial nerve to the cochlear nuclei. The classical pathway is one of 2 ascending auditory pathways, the division for which begin early on in the system in the cochlear nuclei in the lower brainstem. Neurons in the classical pathway have distinct frequency selectivity, as we will discuss with the next slide. The pathway is organised in a hierarchy within subcortical areas and lead to the primary auditory cortex and auditory associated cortices. Higher in the brainstem at the superior olive, some nerve fibres cross over to the other side while others stay on the side they came from. Neurons in the superior olive establish spatial location of sound based on differences in timing and/or intensity of input from each ear. The inferior colliculus in the midbrain is also a point of some crossover. It is also the most prominent place at which the non-classical auditory pathway branches off the classical pathway. As the thalamus, a relay station for sensory input, the level above the midbrain, input is sent to the auditory cortex. At the cortical level, approximately 70% of the input is contralateral and 30% is from the same side or ipsilateral. In the film The Music Instinct, Science and Song by neuroscientist Daniel Levitan, he says the hair cells in the cochlea are tuned to a specific frequency. So, at one end of the hair cells only fire an electrical charge in response to low frequencies. At the other end, they fire an electrical charge in response to high frequencies, and of course, everything in between. So, the signal goes from the ear to the brainstem, then up into the brain, and that electrical charge goes to the auditory cortex, which is amazingly laid out like a piano keyboard. The hair cells are wired to the auditory cortex in such a way that you have low notes stimulating this part of the auditory cortex and on up to the high notes stimulating the higher part. At the near beginning of the pathway at the cochlear nuclei of the brainstem, there is an important offshoot which goes to the reticular formation, a complex neural network in brainstem and midbrain that integrates sensory input, regulates the autonomic nervous system, and projects to the limbic system. It is involved with many behaviours and functions including arousal and sleep, focused attention, vital functions, and sexual arousal. So low in the brainstem, sound is influencing integrative self-regulatory structures. Sound is thereby a stimulus integrated with other incoming stimulation to the nervous system received at that level. That potentially influences self-regulation and vital functions. The autonomic nervous system will be further discussed in an upcoming slide. Auditory association cortices, secondary in association, receive input through pathways from the thalamus as well as from the primary auditory cortex. The input going from thalamus is sometimes considered to be part of the non-classical pathway. These areas are thought to be involved with comparison and categorization of sound. We'll discuss projections to the limbic system, a deep cortical area associated with emotion and memory, as we move on to the non-classical pathway. But keep in mind that through the classical pathway, by way of primary and association cortices, also stimulate the limbic system. Further, other cortical areas, including the prefrontal cortex and the left parietal cortex, can be activated by sound stimuli. Sound's influence on the cerebral cortex is not yet fully understood. It wasn't until the early 2000s that Moller and Associates described what they called the non-classical auditory pathways. Essentially, these non-classical pathways begin with the eighth nerve, as do the classical auditory neural pathways. Where the classical pathways eventually connect with the auditory centres of the cortex, however, the non-classical pathway makes connections within the regions of the brain called the limbic system and the cerebellum. The limbic system is an old neural system hidden deep inside the cortex of the brain. It houses a number of structures, two of which are likely involved in auditory hypersensitivity. One structure involves our emotional reactions and leads to behaviours associated with the fight or flight response. Another is the amygdala, which is the centre of emotional memories. Moller and Rollins demonstrate that the non-classical auditory pathways are highly active in young children and become suppressed as we get older. It's not surprising to see a toddler frightened by a loud, unexpected sound. Often the toddler will cry and demonstrate other negative emotional reactions to such a sound. Over time, toddlers learn to inhibit or suppress the non-classical pathway so that they may initially react to a loud sound, but then gain control and show only annoyance at the sound. As children learn that they are able to control their reactions to annoying sounds, they come to understand the sounds, the things producing the sounds, and the situation in which the sounds occur. They learn that they no longer need to be afraid of such sounds and situations or to avoid them. But what if a child is not able to suppress the non-classical auditory system? What if the non-classical auditory system remains highly active long after it is no longer needed for normal functioning? These questions and the recent interest in non-classical pathways have led to descriptions of how the non-classical pathways may contribute to the behaviours and reactions we see in children with auditory hypersensitivity. Investigators hypothesised that children with sensory processing problems, including children on the autism spectrum, maintain activity of the non-classical auditory system. From this perspective, the negative emotional memories and reactions to sounds and situations in which such sounds have occurred in the past become strongly conditioned into these children's limbic systems. Generalization has occurred so that the children are frightened by things that might make loud and annoying sounds, as well as situations in which such sounds might occur, even if the sounds are highly unlikely to occur. This leads to the phenomenon we call auditory hypersensitivity. To learn more about this topic and how the listening program helps those with auditory hypersensitivity, read the Autism Science Digest article written by Dr. Jay Lucker and Alex Stoneman titled Auditory Hypersensitivity and Emotional Response. The autonomic nervous system, an important control system within the peripheral nervous system, which is involved in maintaining our physiological balance or homeostasis and keeping us safe, involves two complementary systems, the sympathetic system and the parasympathetic system. As studied by Dr. Stephen Porges, physiologic state and behavioural regulation provided through the autonomic nervous system are foundational to social engagement, and the ear is part of it all. The sympathetic system, commonly referred to as the fight or flight system, it is stimulated by physiologic or perceived stress and perceived threat, and it basically gives us more energy and oxygen or reallocates energy to areas needed to cope with the stressor. Sympathetic activity can range from modest to extreme. The sympathetic nervous system primarily uses the neurotransmitters norepinephrine or noradrenaline and epinephrine or adrenaline and the hormone cortisol. Both adrenaline and cortisol serve to alter immune system function and suppress digestion. Chronic high levels of stress and related sympathetic nervous system activity have been found to be related to a number of medical conditions. The parasympathetic nervous system is sometimes referred to as the rest and digest system. It basically works to normalize organ function that has been altered by a sympathetic nervous system response. The parasympathetic nervous system uses the neurotransmitter acetylcholine. Noise is a biological stressor. The sympathetic nervous system is activated at 65 to 70 decibels, which is a lower volume level than sound is actually damaging to the auditory system. Sounds, language, and music can affect both the sympathetic and parasympathetic systems. When the sympathetic system has been activated due to danger or stress, listening is more compromised because the ear's mechanism for receiving input, particularly the middle ear muscles, do not work well. Listening and the role of the middle ear muscles contributes significantly to social engagement, as pointed out by Dr. Porges. When the ear's ability to take in important relational input and filter what is not needed, such as tuning into voice amidst background stimulation, is not working, listening diminishes and engagement decreases. This is often seen in individuals with conditions including sensory processing disorder, autism spectrum disorder, anxiety, chronic stress, post-traumatic stress disorder, and psychiatric disorders. A sense of safety and comfort, along with an optimally functioning middle ear system, are among key contributors to social engagement as related to the physiological and behavioural foundations provided by the autonomic nervous system. The enteric nervous system is a complex, independent nervous system that lines the gastrointestinal tract from the esophagus to the anus and contains roughly 100 million neurons, although some regard it as part of the autonomic nervous system. It has been found to partly determine our mental state, influence our emotions, and play a role in wellness. It enables us to sense and control our gut and its process of digestion through its own motor and sensory system. It also responds to messages, especially fear, from the brain in our head. The vagus nerve is also involved in this system, carrying information from the gut to the brain. Although both can operate independently, the link between the mind, the gut, and our digestion is thought to be rather intuitive. Most of us probably know it all works best when we're in a good mood. When we're under stress, the enteric nervous system shuts down digestion. As we've been discussing, auditory stimulation can help create or eliminate stress, influence stress-related functions and dysfunctions, and affects mood. The next time you're eating fast in a noisy, bustling restaurant, or get that good feeling in your gut when you hear a favourite song, or have a hard time listening because you've got butterflies in your stomach, think about your enteric nervous system and its relationship to sound. This may be the system which has influenced successful toilet training outcomes when following a TLP protocol with combined bone and air conduction listening. We've touched upon many topics since introducing and discussing the responsiveness of the receptors within the vestibule of the ear, the saccule and the utricle. Let's return to the vestibular system and talk about the path of neural impulses once these vestibular receptors have been stimulated. The eighth cranial nerve, the vestibular cochlear nerve, which we've already talked about as carrying neural impulses from the cochlea, carries input from the hair cells to A, the cerebellum, or B, the vestibular nuclei in the brainstem. Sound of sufficient frequency and amplitude affects posture primarily by way of the vestibular spinal tracts. Neural pathways extending ipsilaterally from the vestibular nuclei to all levels of the spinal cord to stimulate extensor muscles, such as the trapezius and the quadriceps, and two, specifically innervates neck muscles. Sound influences eye movement through a pathway that projects from the vestibular nuclei. Vestibular projections also stimulate the reticular formation, thalamus, and posterior parietal and superior temporal areas of the cortex. However, our research has not identified specific vestibular responses to sound that have gone on to stimulate these areas. The brain is musical. Music is teaching us about the brain, and the science is teaching us about the music. Advances in functional neuroimaging are giving us unprecedented data about how what we hear transforms our brains and our lives, and the role music plays in who we are. Music lights up almost every area of the brain, which shouldn't be a surprise since it makes people tap their feet, encourages the recollection of vivid memories, and has the potential to lighten mood. Hearing is passive and is the ability to sense sound. Listening is active and is the ability to take in the sound we want to hear, such as language, and to block out or inhibit the sound we don't, such as background noise. So we essentially listen not only with our ears, but with our brains. Auditory processing is traditionally and simply viewed as what the brain does with what it hears. It is a dynamic and complex with broad impact what the nervous system does with sound stimulation. We've provided you with a comprehensive list of specific auditory processing skills. Now most of us are familiar with the idea that the auditory processing involves a number of specific attention and perceptual skills. Beyond these specific skills, the processing of auditory input and the integration of auditory-based input from other inputs has potential broad impact on behaviour, ranging from self-regulation to skilled performance. As you can imagine, auditory processing involves more than the auditory system itself, but rather at least 6 integrated systems as identified by Dr. J. Lucker. These systems include self-regulation, auditory system, emotion, memory, language, and cognitive decision-making. So we know that sound changes the brain, from the effects of interuterine listening on the developing nervous system to the sounds of the last moment of our lives, during wakefulness and sleep, through a combination of air and bone conduction. The sound we hear and actively listening to provides our nervous system with complex stimulation that can, 1, elicit physiological change within the nervous system and observable function of an individual either directly or indirectly, 2, spark behavioural responses, and 3, influence self-regulation, communication, learning, performance, emotionality, and well-being, and more. Brain plasticity is now a well-accepted phenomenon, although it's not yet fully understood. We know music engages more brain regions than any other known stimulus. Its impact is astonishingly far-reaching. What we do with what we hear and what our nervous system do with what sound extends beyond auditory processing into an especially broad yet individualized area we call sound-brain fitness. Enhancing the frequency, volume, space and time elements of sound by aesthetically pleasing acoustically modified music, the listening program was specially arranged, recorded and created with the intention of providing a music listening tool effective in helping people change. We're letting sound do its work. So acoustically modified music. In this session, we'll examine why the listening program is more than music and just what makes this acoustically modified music singular in the field. The foundation of the listening program is the exquisite music created by our founding musical director, Richard Lawrence, who lived from 1946 to 2005. Lawrence was a conservatory-trained violinist, composer, arranger, producer, audio engineer and music teacher who was born in Troon, Scotland. He was raised in an accomplished family of musicians. He collaborated with our team to create a vast library of high-definition music, recordings of mostly original arrangements of classical works. This catalogue and most of the other music used in our music programs is performed by the award-winning Ancongelis Chamber Ensemble. This extraordinary ensemble was the first, and to this day, the only production ensemble of its kind. Made up of world-class musicians, many of whom were students of Lawrence, they were each handpicked to be involved in our music production process. Each musician was selected not just for their technical acumen, but also their interest in creating music that would not be used just for entertainment, but rather with the intention to touch the heart and change the brain of those who experienced it. Richard's son, Greg, followed in his footsteps as a percussionist and professional audio engineer who worked with his father and Alex Doman on the production of most of the listening program modules. As we can see, We create the music to have an effect, not purely for listening enjoyment, but to truly have an impact on our brain, body, and emotions. It is impossible for us to achieve what we do with pre-recorded music. Our high standards for evidence-based music and innovative approach towards neuroacoustic processing require original productions. To help you understand how much goes into creating the listening program, let's do a quick review of what goes into our continuous music production cycle. There are major steps that are involved in each listening program production, including the original idea or concept, choosing the team, doing background research, composing and arranging music, selecting artists and technology, recording and editing and sequencing the music. At this point, we integrate neuroacoustic processes into the music, review compiled sections, test, amend, move to clinical testing, and then finally release a new TLP program when ready. Some programs have taken as long as 5 years to produce to our exacting standards. The recording studio is an important consideration for us, since a variety of techniques are initiated in the recording sessions. For music recorded for our spatial surround processing, the studio must have separate soundproof rooms for each musician. Using this means of recording allows us to create the various techniques we apply in the post-production processes for the listening program. The studio also needs equipment capable of recording at the highest available levels of digital information, 24-bit resolution, with 192 kHz sample rates. This means the music will have more information for the brain to process, providing greater stimulation. It also adds to the richness, depth, and emotion for a more satisfying musical experience. The listening program is created from the ground up, starting with our own arrangements and recordings of musical compositions by Mozart. We use Mozart because of the highly organized structure, temporal elements, frequent repetition of melody, and accessibility, which is essential given our listeners are from diverse cultures around the world. We also use pieces by Haydn, which have some similar characteristics to Mozart, composition in addition to works by Vivaldi and Danzig. Each module follows Advanced Brain Technologies' proprietary ABC modular progression, which takes the listener through multiple levels of sound training in 15 minutes. The modules include seamless tempo entrainment and transitions within, musical complexity, tone density, spatial training, frequency focus, and volume dynamics. These move through a sequence of low to moderate to high to moderate to low intensity training over the course of 15 minutes, which provides a balance of stimulation and grounding to support self-regulation. The listening program is the only listening method to offer original recordings at 24-bit high definition. This is the highest music recording quality as compared to the standard recording quality of 16-bit. These recordings are the most comparable to a live performance and contain more depth, detail, dimension, and emotional expression than other recording methods. High definition captures the detail of the harmonics that gives music its sound, colour, or timbre. This improves the ability to distinguish the sound of each instrument, which affords the listener more opportunity to benefit from their listening. When we produce the listening program, we plan for what frequency zone is being created to support. This impacts many of our production decisions, including musical genre, style composition, arrangement, instrumentation, musicians, recording environment, microphone selection, and neuroacoustic signal processing. The music in the blue zone is comprised of the full range of sound frequencies from 20 to 20,000 Hertz. It includes low, middle, and high frequency music that leaves the listener feeling balanced. The music in the green zone contains the full frequency spectrum with an emphasis on low frequency music being below 1500 Hertz. The music in the green zone helps the listener feel grounded. The music in the orange zone includes the full frequency spectrum with an emphasis of mid-frequencies in the range from about 500 to 5,000 Hz. The music in the orange zone leaves the listener feeling focused. And the music in the red zone, which also includes the full frequency spectrum with an emphasis on mid and high frequencies over about 1,000 Hz up to 20,000 Hz. The music in the red zone is alerting and provides a feeling of being energized. Various types of neuroacoustic signal processing are applied to the original recordings created for the listening program. These are techniques achieved through the use of digital signal processing software. These are useful to increase and emphasize the perception of the natural attributes inherent within the musical structure. The modifications provide the sound contrast needed to train and improve sound perception. The primary modifications applied are spatial surround dynamic, Dolby headphone, active listening training sweeps, filtration, audio bursting, and blends. There is so much more involved with the proprietary techniques, but we'll explore some of these production techniques in more detail so you can have a fuller understanding of the acoustically modified music in the listening program. Spatial surround is a music recording and production process we developed in which multi-channel sound is presented to provide music in 5 individual channels or locations. This is similar to surround sound, only more precise. Spatial surround dynamic is spatial surround with movement of the individual instruments or nature sounds. So we live in a 3-dimensional world and rely on our auditory system to tell us where our body is in space and to inform us if our environment is safe. Spatial surround was developed to replicate the natural environment to provide more complete training to the auditory system, rather than simply stimulating perception of sound from right and left, which is all that can be done in stereo. Spatial surround is exclusive to the listening program and helps improve discrimination of frequency, volume, time, and spatial location. To help you better understand spatial surround, you'll watch these 3 music videos. At the core of the circle, you'll see a green outline which represents the music. As the instruments play in the different locations, the outline will change to display the approximate location and volume intensity of the music. As you listen, look at the soundscope to see if you can hear the music where you see it. The visual feedback will give you appreciation for what spatial surround does to train auditory skills. This is Danzi in spatial surround. And now we have spatial surround dynamics, so you'll notice that the movement has been added to the music. Dolby Headphone is the technology that makes it possible to provide spatial surround on waves and other high-quality TLP-approved headphones. The technology works by creating an acoustic model based on how the ear and brain localize sound using a powerful signal processing algorithm. It generates audio cues modeled from real life. You perceive you're in a home theatre when in fact you are listening through stereo headphones. ABT offers this technology under license from Dolby Laboratories. It's important to note that Dolby Headphones is not a special pair of headphones, but rather a technology that ABT encodes into the music files. Active listening training is a process exclusive to the listening program and was created to improve attention, frequency and volume discrimination, spatial awareness and sound localization. It was introduced in our Spectrum and Achieve listening programs. ALT, Active Listening Training, is presented in spatial surround. It eases people into listening by using a spotlighting technique to bring attention to one instrument in that 360-degree spatial field for short durations of time, and then progressively spotlighting others through changes in instrument volume and timing throughout the module. This offers a constant spatial reference to help the listener better understand his or her position in time and space, and serves as the foundation of the spatial progression in the listening program. ALT active listening training modules include no filters, audio bursting, or spatial surround dynamics. This gives the lowest intensity rating in the listening program, which is a rating of 1, and they are used in the blue zone. Filtration is a process in which audio filters screen out or remove selected frequencies from full spectrum sound. It's helpful to think of filtration as removing something to emphasize what remains, so attention is drawn to it. Filtration directs attention to the non-filtered frequencies and helps listeners to perceive and discriminate sounds they may otherwise not be aware of. This is similar to highlighting a passage of text in a book for emphasis on a key idea. Rather than highlighting text, filters fine-tune the stimulation of the frequency zones. This improves auditory discrimination and provides very direct stimulation to auditory neurons to further the effects of music-induced auditory plasticity. Filters are used in all zones except for blue. There are 3 types of filters utilised to train the frequency zones. Low pass trains the green zone, band pass primarily trains the orange zone, but some of the red, and then high pass for zones orange and red, primarily red. To demonstrate the filters, we'll first play you full spectrum of music in the blue zone. In the listening program, we blend the filtered music with full spectrum music to reduce the edge and make the music enjoyable to listen to. The full spectrum music plays at a lower volume than the filtered music. In addition to reducing the edge of the filters, this also provides something for the brain to contrast the filtered music against, which helps improve sound discrimination. Let's begin with full spectrum music in the blue zone. Green zone. This is blended with a low pass filter at 750 Hz. So most of the sound above the filter has been removed. Full spectrum music playing at a softer volume has been added. Notice how you are drawn to listen to the low grounded frequencies. This filter provides training in the green zone. orange zone filtration. This is blended with a band pass filter from 500 to 4000 Hz. Most of the sound below and above the filter has been removed. Full spectrum music playing at a softer volume has been added. This filter is providing training in the orange and red zones, primarily orange. Then we move on to red zone filtration. This is blended with a high pass filter from 1000 Hz. Most of the sound below the filter has been removed. Full spectrum music playing at a softer volume has been added. This filter is providing training in the orange and red zones, primarily red. Audio bursting is what we're going to look at now. So audio bursting is another neuroacoustic modification used within the listening program. The process involves rapid novel volume increases in the music and is only applied in the B phase of a module. Audio bursting replicates the passive, relaxed and active alert phase for hearing and listening. An example would be what the brain does when we are trying to listen in a noisy environment like a restaurant. The middle ear attunes to the sound of the voice while attenuating the background noise. Audio bursts set the middle ear into its reflexive action, which helps the brain to dampen or attenuate loud sounds to protect the inner ear and to amplify or attune to soft sounds for improved sound discrimination and vocal control. The audio burst provides specific training to the auditory tonotopic map for improved frequency discrimination and is believed to contribute to reduced hypersensitivity to sound as seen through improved social engagement in listeners. The music in the listening program was produced so that each instrument was individually recorded in its own separate channel. The instruments are audio bursted specifically in the frequency range of each zone, which provides very refined training facilitating music-induced auditory plasticity of the auditory tonotopic map. This provides more specific audio bursting in each piece of music and within each zone and results in more effective listening training. Audio bursting is exclusive to the listening program and is used in mild, medium and advanced module types. Note, the higher the module is rated, the more intensive the audio bursting stimulation. To give you a better understanding of audio bursting, I'm going to play you music videos that show a spectrogram of the music being audio bursted. As you listen to the audio bursting sample, keep in mind that before this is heard in a listening session, the listener will have completed 5 minutes of listening to an A phase to help prepare the brain for the audio bursts, and will then have 5 minutes to integrate the experience in the C phase. Let's start with full spectrum, which is what you will hear in the blue zone. Then we'll listen to audio bursting in the orange zone. So full spectrum music is blended with filtered music and the filtered music is audio bursted primarily in the orange zone and passed. So I hope that you've enjoyed your initial start to your professional training for the listening program. And if you have any questions from what we've gone through now, I suggest you keep them with you. And when you join me for day 2 of the live training course, we can go through and answer any of those questions that you've got. And so to finish off, I would like to give you the opportunity to listen to a sensory integration album, which has a focus on the green zone. So plug your headphones into your computer and sit back and relax and enjoy sensory integration.
This module is now complete.
So now you've successfully completed your second session of listening. I'm sure you noticed the different psychoacoustics in that sensory integration album as opposed to the first full spectrum one that you had the opportunity to listen to. So I look forward to meeting you for day 2 of our live training course.